Hello, this is Arnaud. In this blog, we will discuss a challenging rhythm. This patient came in with shortness of breath. What is the rhythm? This is a regular narrow QRS rhythm at a rate of about 90 beats per minute. There is poor RV progression and low voltage limb leads. The P waves are inverted or negative in 2, 3, and AVF, upright or positive in AVR, AVL, and V1. The atrial rate is best computed in V1, where it can be seen at the rate of about 188 beats per minute. In between P wave is a clear isoelectric line. There are 2 P waves for 1 QRS, or there is 2-to-1 AV conduction. What is this rhythm? Atrial tachycardia is typically defined as a regular atrial rhythm with a rate around 100 to 240 beats per minute with an isoelectric baseline. Atrial flutter, on the other hand, is defined as a reentrant arrhythmia with a regular pattern at a rate above 240 beats per minute with characteristic flutter wave. I would like to quote verbatim the thoughts of Drs. Das and Sipes regarding the semantics of using atrial tachycardia and atrial flutter from their book Electrocardiography of Arrhythmias. Atrial tachycardia, or AT, is defined as a regular atrial rhythm originating from the atrium at 100 to 240 beats per minute. The presence of an atrial rate above 100 beats per minute with 3 different P-wave morphologies signifies foci of atrial depolarization and is called multifocal atrial tachycardia, or MAT. Previous classifications of atrial tachycardia has been based exclusively on routine EKG with a constant rate and an isoelectric baseline between 2 consecutive P waves. Atrial flutter is typically a reentrant arrhythmia defined as having a pattern of regular tachycardia with a rate above 240 beats per minute without an isoelectric baseline between deflections. The typical atrial flutter, or the cavotracheosphere dependent atrial flutter, usually shows sawtooth pattern in inferior leads. Atrial tachycardia can also have a reentrant mechanism, usually seen around a scar in the atrium. The EKG pattern can mimic an atypical non-cavotracheosphere dependent atrial flutter. However, neither rate nor lack of isoelectric baseline is specific for any tachycardia mechanism. A rapid atrial tachycardia in a scarred atrium can mimic atrial flutter, and on the other hand, a typical atrial flutter can show distinct isoelectric intervals between flutter waves in diseased atria or in the presence of antiarrhythmic drug therapy. Therefore, it becomes a matter of semantics to define an atrial tachycardia or an atypical atrial flutter. So if we follow those thoughts, then this is atrial tachycardia versus atrial flutter with 2-to-1 AV conduction.